Continue the conversation now and get official word on how the second phase of the vaccine rollout is going in Cape Town, in the Western Cape in particular. The provincial head of health, Dr. Cloete, has called it an emotional day. He says people over 60 who've been living in fear, isolated from their families, will now be able to reclaim their dignity. Dr. Cloete joins us now live via Zoom. Thanks for your time, sir. I know it's obviously a very busy day for you. Let's first talk about overall throughout the province. How's it going?
Good afternoon, Shahan, and good afternoon to the viewers. We're very pleased to say that it's going very well in Cape Town. We couldn't have asked for better weather, Shahan. It's a beautiful day in Cape Town, but it's going extremely well across all the sites that came online today.
So we spoke to our reporter, and she says it is a bit of a slow approach because you don't really want elderly people queuing up in long lines and, of course, exposing themselves to COVID-19.
Yes, we've taken a very deliberate approach, Shahan. We have very clearly asked people to wait for them to be invited to come to the place. So many of our places, there were people over the age of 60, but in smaller numbers. As they were invited, and also many of them receiving SMSs via the system to present themselves. But our teams have moved very quickly to make it spacious, dignified, and the big thing for us is to have a dignified experience of all the people presenting themselves in and out as quickly as possible, without any crowding, and especially not putting them at risk because we are in a resurgence of cases in the Western Cape.
So how many people are you looking on average to actually get inoculated per day?
We have 33,900 vaccines of Pfizer that we've received. What we're doing in the first 2 days is testing our systems. And then towards the end of the week, we're aiming to move to between 500,000 and 600,000 per day by Thursday, Friday. That's our aim. And then we want to bring more sites online next week and the week after, so that we systematically move our way from 5,000 to 6,000 a day to 10,000 a day to 15,000 a day. So that's our plan over the next 2 to 3 weeks.
Yeah, and this safe approach, obviously very necessary given that we're almost getting to a third wave in several other provinces. But the delay is still a concern, isn't it? Because we have people dying daily of COVID-19 related illnesses.
Yeah, so it is a balance, Shahan, and we have to make sure that we get the balance right. So for us, it is really the first couple of days is learning and making sure that we get the safety in place so that we can give people a dignified experience at many sites and bring them in. But at the same time, our teams have also gone out to old age homes. So we're reaching between 25 and 40 old age homes this week, and the teams are systematically going out into those settings as well. So we're very mindful of the balance. And we're very mindful that we must do this as quickly as we possibly can to be able to vaccinate as many people as possible, and at the same time get people over the age of 60 to register. In this province, 220,000 people out of 720,000 that we think should be vaccinated has already been registered. So that's about 30%, but we want to increase also the registration, and especially in the underprivileged and socioeconomic deprived areas, because we can pinpoint where the people have not registered. So while we're preparing to scale up our systems, we're also going out to actively encourage people to register so that we can bring them into the system in a systematic way.
Oh, have you been able to tell which areas people are not registering in?
Yes, so we've pinpointed it into, as I said, mainly socioeconomically deprived areas. So in the Cape Metro, an area like Cloete is low compared to other areas. An area like Mitchell's Plain, the overall area is low, but pockets in Mitchell's Plain is low. And even if you go to a place like Tygerberg Sub-District or Eastern Sub-District, when you go into those areas, the more affluent areas will have higher registrations. The more deprived area in those areas have lower. So if you compare a place like Bellville to a place like Delft, you see a distinct difference. So we can pinpoint those areas and now put all our resources to bear to bring the most vulnerable, to give them an access to be able to register for the vaccine.
Yeah. So let's talk about what happens if, let's just say, you say 10 people should come and get inoculated today, but only 5,000 or 6,000 show up. What happens to the vaccines? Does it roll over? Do you ask people to come in and do walk-ins or not?
What our teams do at the places, the vaccines that they have in the place is a sufficient vaccine to be used on that day. Because once you open Pfizer, you mix it, you reconstitute it, you have to have the vaccine used within 6 hours. So we obviously very clearly to titrate that we get the right numbers, we have the right number of vaccines vials that we have in the place. So that's also part of this, that we want to actually test how we're going to get that right. So you need to get the numbers right. You also need to get the vaccines right. And you start reconstituting, you must use it before the end of the day. So that's why, in a sense, we're doing healthcare workers together with people over the age of 60 to make sure that there's as little wastage as possible of the vaccine.
Yeah, and obviously the wastage is not something we can afford, right? I want to talk to you about the rural areas in the Western Cape, outside of Cape Town, of course. The Pfizer vaccine is something that's difficult to store because of the temperature that's needed. How then do you reach those rural areas and make sure that we get equal opportunity when it comes to vaccinations?
So this week, for the next 5 days, we specifically trying to get everything that we need to learn in the metro. So with the 7 sites are all in the metro, 10 sites will be in the metro. We're starting next Monday with sites in rural. So we are putting all our systems in place to transport, to make sure Pfizer needs to be stored at -70 if you are not going to use it within the next 5 days. So the moment we take it out of -70, and we also take small amounts out, because that amount, the moment you take it out and you transport it, then if it starts thawing and it's below 70, you need to use it within 5 days. The moment you open it and you reconstitute it, you need to use it in 6 hours. So we're getting all of those logistics right, but we will be delivering vaccines then to our rural areas start Monday and get it titrated from the lessons that we've learned in the metro to make sure that there's no wastage and that we maintain the cold chain as best as we can for the distances that we have to travel.
I know you have to get back to work, so one last question. That, of course, is whether all of the planned vaccine sites in the Western Cape have opened, because we've seen some in other parts of the country not opening.
Yeah, so we were very deliberate in that, Shahan. So we said 7 sites today, all 7 is up and running. They're doing what they need to do. By the end of the week, it will be 10. By next Monday, it will be 17. By the week after, we will start moving quite fast in terms of incrementally increasing those numbers. Our target of public sector sites is to get to 270 sites for the province, but we will do it on the basis of increasing it every week based on the system we put in place. And that we will bring private sector sites in addition to that online. So we got a clear plan for the next few weeks. We'll bring on the sites fast, but with the understanding that when we say a site come online, it's got all the systems, it will run, there's people, and we can do it as smoothly as we can.
All right, thank you so much for your time. We appreciate it. Good luck with that vaccination rollout. Western Cape, Head of Health, Dr. Cloete.